Hi, my name is Sophia Mavrommatis, and I'm a third-year medical student. Is bracing after hip arthroscopy really necessary? So what is hip arthroscopy? It is a minimally invasive procedure, meaning it's performed through a small number of incisions or cuts, and it can be used to treat various hip problems or hip pathologies. And so on the right here, you can see the arthroscope, or the small camera that is used to look inside of the hip joint and perform these procedures. This is something that's been around for a number of years, but only relatively recently has it really surged in popularity. From 2004 to 2009, studies have shown that there was a 250% increase in the number of these types of surgeries performed. And then from 2005 to 2010, there was a 600% rise. And so surgeons may recommend postoperative hip brace use because they believe that it provides stability to the patient and/or limits lower limb motions that can negatively impact recovery from surgery. The use of crutches and physical therapy or other treatment modalities that may be used post-hip arthroscopy. But with regards to hip brace use, surgeons recommend wearing hip braces following hip arthroscopy at variable rates. For instance, a 2020 study found that 40% of expert surgeons, as they defined it, recommended the use of hip braces following arthroscopic hip surgery. So 60% did not recommend it. Another study also found comparable results and found that most surgeons never or rarely recommended the use of hip bracing after surgery. And among surgeons that did recommend the use of bracing following hip arthroscopy, the length of bracing and the type of bracing was also variable. And so is hip bracing after hip arthroscopy effective? The answer is we don't really know. There's no clear evidence or research that has been published that proves that effective is a bracing treatment option. There have been studies that explore this as a conservative treatment option, but the results of those studies are mixed, and thus it's fair to question the efficacy of hip bracing and improving patient outcomes following hip arthroscopy as well. So all in all, more research really is needed. And why does this matter? It matters because wearing a brace for several weeks after hip arthroscopy surgery is cumbersome, and it can affect patients' quality of life. Patients report it is heavy or itchy. And so until there's further research that really proves this is effective, it may not be necessary to suggest patients endure this potentially uncomfortable measure while recovering. So again, more research is needed before subjecting patients to this. Thank you.